you tell us your name and title, please, and how long you've been working with Bozeman?
Yeah, so my name is Ben Rafato. I'm an emergency medicine physician, and I joined in 2016, so 10 years.
My name's Eric Lowe. I'm an emergency medicine physician, and I've been working at Bozeman Health in the emergency department for 17 years now.
My name's Nils Harden. I'm a physician with Bozeman Health, and I've been here 6 years.
What drew me into emergency medicine, I think, was I tried a whole bunch of different rotations, as we all do, and it was just kind of the aha moment when I felt like this is where I belong.
Quickly saw that emergency medicine was a platform unlike any other, where you see people at their worst. You never see a scheduled patient. No one ever wants to be there.
I often say it's the first place I rotated in medical school where I noticed I didn't look at the clock. The variety, the fast pace, the not knowing what the day is going to bring continues to keep it fresh and exciting, and that keeps me coming back.
A letter here from one of your patients expressing some gratitude to you. Do you have any idea what this letter may be about?
I don't, no.
I imagine it's about a patient that I took care of. Hopefully had a good outcome.
I don't. I haven't seen it.
Dear Dr. Rafato, I want to thank you for the exceptional and timely care you provided for me, as well as the mark you left on me as your patient. Last year, in the early hours of November 6th, I was guiding elk hunters in southwest Montana. Thinking I might have had an ulcer or gallbladder issue, I left my hunt and drove myself to Bozeman to seek help from the emergency department. Upon arrival, I checked into the emergency department and was immediately taken into an exam room where I met you. You were calm and attentive. You asked how I felt and what I was experiencing. I had no idea that I was having the old heart attack, but felt very fortunate that you did and took immediate action. The next thing I knew, I lost my clothes, got a gown, and woke up and was told I'd had a stent placed in my heart. Of all the things that happened that November morning, your care and attentiveness are amongst the things I'm most grateful for and will remember forever. Your expertise and decisiveness were critical to my health and are significant reasons why I recovered from the event. Thank you for being there to help me when I needed help. Thank you for helping me get back to the people I love and the things I enjoy doing most. I very much appreciate your effort and the rest of the hospital staff. Sincerely, Jerry Ryder.
Dear Dr. Harden, it is difficult to fully capture our gratitude for the care you provided our daughter, Lou Ella, a couple of weeks ago. But please know how deeply it is felt. We arrived on a Sunday evening, concerned and unsure. Lou Ella had just recovered from the flu when her fever suddenly returned, accompanied by intense pain in her calves, so severe she couldn't walk, and even the lightest touch caused her distress. As parents, it's a helpless feeling, but from the moment we walked into the emergency room, your team met us with calm, compassion, and steady reassurance. When she was admitted, your team continued to build her up, reminding her how brave she was, and something remarkable happened. By the next day, when she was starting to feel better, she spoke so positively about the people who cared for her the night before, especially the doctor with the cool glasses and the nurse with long blonde hair. That kind of impact goes far beyond clinical care. It's human and it lasts. We are so grateful to have an emergency department so close to home, staffed by people who lead with both skill and heart. Thank you for taking care of our daughter and for the countless ways you show up for families like ours every single day. With sincere appreciation, the Schmidt family. That's nice.
Dear Dr. Lowe, I want to thank you and your emergency department clinical team for the incredible care I received during an episode of cardiac arrhythmia last fall. I woke up on a Sunday morning to my heart racing after what I thought was a normal night's sleep. Having never experienced anything like this before, I didn't know what to expect, and as someone who's a bit of a control freak, that terrified me. I drove myself to the ED, and upon arriving, was triaged immediately and told my heart was beating over 160 beats per minute and that I was in AFib. I didn't know what that was, but I knew it wasn't good. Your team immediately got to work and explained in detail what was happening and why it was a problem. For somebody who wasn't in a good emotional headspace to begin with, I was most grateful for the time and the way they described what AFib was and what they were going to do to try to control it. The doctor came in and explained I needed to have my heart shocked back into a normal rhythm via a process called cardioversion. I began to become emotional, realizing the intensity of what was happening. Your team again stepped in with their calm demeanor and helped me understand the procedure, how it would work, the risks, and answered every question I had. A few minutes later, I was being sedated for the procedure and didn't feel anything as they shocked my heart back to a normal beat. When I woke up, the nurse told me I was okay and that the shock worked perfectly. I've never been a frequent flyer of the ED, no offense, but reflecting on my experience afterwards, I realized how incredibly lucky I was and am to have this hospital and your medical team just around the corner. Thank you for what you and your team do for our community. Thank you for being there when I needed you and for helping me get home in one piece. Sincerely, John Wells.
So when you read that and understanding the experience that your care team provided, what does that mean to you?
Very often we don't get to see people after we see them for an emergency department visit. And notes like this that reassure that we're doing the right thing and that the patient is feeling well taken care of are really meaningful.
It's heartwarming to hear. We see people oftentimes that come in and we know there's something critically wrong. We kind of have to recognize that and set them on a path. But we don't oftentimes hear what their experience was in retrospect, and it's heartwarming to hear that he had a good experience and sounds like he's able to get back to the things that he loves to do. And I feel happy to be part of that pathway.
What reminds me of just how this is a team sport, how many of those key players all work together and each one has their key role. And I appreciate that. Bozeman's the land of the extremes. It's still the Wild West, so to speak. I really appreciate the fact that we are the one hospital for a large region with a significant catchment area. And in that, it requires collaboration. And this is a place that does that. It's a very close medical staff that shows up, that's connected, that collaborates. And in that, there's a real strength that I do think the community feels.
It's a privilege to work here, and I'm very fortunate.